Hi, this is turn my face on. Hi, this is Dr. Jeffrey Hanna at Atlas Health Australia, and I want to share with you how a Blair upper cervical adjustment actually works. There are a few ways that a Blair upper cervical adjustment is different from a general spinal manipulation. Firstly, the precision and the force. Remember, in previous videos, we talked about specialized x-ray where we measured the misalignments in your neck to within half of a degree. They showed us the exact angle that we need in order to deliver your adjustment with the least amount of force, but with the greatest potential for a positive effect. And the analysis we perform on your films allows us then to make an adjustment with the least amount of force also. It's like opening a locked door. If the key fits, the lock opens with ease. So when the adjustment is custom tailored for your bone structure, the misalignment should also correct with ease. Now, the Blair adjustment sometimes can look a little dramatic, but the amount of force is exceptionally light. Approximately, it's what you're going to use to feel your pulse. That's it. Second thing that makes a Blair upper cervical adjustment different is that your head is in a neutral position. There is no cracking. The way it's done is where you're actually lying down on a very low table. The reason for that is because it allows for the doctor to get over top in order to deliver a line of drive or a vectored force in a way where they're not having to hold you up here, where you're feeling tense, where you're feeling uncomfortable. So it's going to be in a position where you are neutral, comfortable lying down on your side. And the adjustment itself is performed in that position where your neck is going to stay neutral. And what that does is that rather than twisting or cracking things like this, it allows the vertebra to realign within its normal range of motion without having to crack anything again. So I'm just going to describe this briefly, how an upper cervical adjustment works using the Blair technique. Step 1. You lie on your side with your bottom arm wrapped around your ribs and with the top arm lying straight down at your side, kind of like this. And your bottom shoulder is going to be resting on a soft pad underneath you, and with your head resting on a firm but also on a comfortable headpiece. The idea is for you to be as relaxed as possible, like falling asleep. If you're uncomfortable or in the wrong position, see, your neck muscles will automatically tense, which makes the adjustment less effective. The specialized headpiece on the table, it rises about 1 to 1.5 centimeters. That's it, just before the adjustment. And then it releases, producing a tiny vibration that allows the vertebra to realign with less effort. Step 3 is the adjustment itself. The adjustment happens where I use the tip of my hand to direct a three-dimensional force, again, equal to the amount of pressure you use to feel your pulse, at the angle that we measured from your x-rays that helps to unlock this subluxated vertebra, taking the pressure off the brainstem so that your central nervous system will be better able to begin that healing process. When we table the adjustment for your own bone structure, like a key opening a lock, again, we don't need to use that much force at all. And although, yes, the headpiece makes a little bit of noise when it releases, that's the only sound that people hear with the adjustment. In fact, the vibration, it's commonly the only thing that people feel when the adjustment happens at all. Most people say, well, Jeff, I didn't actually really feel anything. Have you done anything? But they'll quickly discover that even the lightest of forces, when it's being specifically applied, can make a massive difference throughout their body. I hope that clarifies a little bit, just on a description, what we do with the Blair upper cervical adjustment, how it's different from what many people know as general chiropractic manipulation. This is Dr. Jeffrey Hanna at Atlas Health. Take care of your neck. It's your lifeline to well-being.